Hi, I'm Dr. Stephen Stokes and welcome to the channel. Today's video is on neck pain. If you're having problems with your neck, then you already know life can be miserable. And there's a lot of neck problems in society today, and I think it's because we spend a lot of time on cell phones and on the computer. It puts our neck in weird positions that we're not used to, and as a result of it, we cause damage. Now, problems in the neck can also cause symptoms in other parts of your body. For example, you can have numbness and tingling in your hands, weakness in the muscles of your arms. You can have headaches. In severe cases, neck problems can also irritate the vagus nerve, and that can cause problems with your gut, even anxiety and depression. So the neck is like the power conduit that connects the brain to the rest of the body. Problems in the neck have to be resolved or it can make your life miserable. A lot of people seem to think that most neck problems have to do with the muscles of the neck, and that kind of makes sense. However, the muscles are always secondary to the deeper problem with chronic neck pain. That deeper problem is spinal disc disease. In the bones of your neck, between them, there are cushions, shock absorbers called spinal discs. They have two purposes. One is they separate the bones and allow your head to move. So they create a joint that allows us to move our head comfortably. But secondly, like I said, they separate the bone, which creates a space. And through that space, the spinal nerve runs. And that nerve comes out of your neck and goes to other places in your body. When the spinal disc is unwell, it begins to break down and degenerate. Sometimes it bulges or herniates and pushes out into that nerve hole, compressing the spinal nerve. When this happens, you're going to have pain. And wherever that nerve goes that's being compressed, you can also have symptoms. Now, when you get a spinal disc problem, your brain's first response is to tighten the area to protect it, and that makes sense. So all the muscles of the neck become tight and spastic, and that tightening of the muscles can cause a lot of pain. So much pain that a lot of people will think that that's the primary cause, but it's not. The muscle pain is really a defense mechanism. It's your body's way of telling you, hey, stop using your neck so much and let it rest. What does the neck need in order to heal? Well, unlike muscles, it doesn't need exercise. You can't exercise an injured spinal disc in your neck. In fact, exercise will only make it worse. What the neck needs is rest. It needs an opportunity to decompress the spinal disc, taking all the pressure off of it and creating a slight negative pressure. This little negative pressure created with decompression will slowly draw the disc back into its normal position, like pulling the plunger of a hypodermic needle. Now, it takes time, but it does work that way. And most spinal disc injuries in the neck can resolve anywhere from 30 to 90 days. We have MRIs of that showing that they do heal on their own, despite what you may have been told. Now, there are several ways to create spinal decompression in the neck, but the least expensive and most effective way that I have found is using a device made by DDS called the Cervi-Trac. And the Cervi-Trac is a traction-based device that you can put around your neck and inflate with a hand pump to decompress the joint, take all the pressure off the disc, and allow it to resume its normal position. It works so effectively that most people feel improvement after the first 20-minute session. DDS offers this device, and I'll put a link below, with a 60-day free trial, risk-free. So if you use it and it doesn't help your neck pain in the first 2 months, they will return all of your money. It's a great deal and a great company. Let's have a look at the Cervi-Trac. When you're using the Cervi-Trac, there's a few things you need to know about. First of all, make sure your chin fits into this slot at the front of the device. That will make it a lot more comfortable for you, like so. Make sure also that the two straps are equal and one is not more left or more right than the other. Once in place, attach the pump, and notice on the pump there are different colors, green, yellow, and red, with obvious implications. What you want to do is start off inflating until you just start to feel some pressure. As soon as you get that little bit of pressure, leave it. Hold that position for maybe 30 or 40 seconds, and then pull the tab to release the pressure. You may at that point want to reposition a little bit if you notice there was some areas uncomfortable or some sharp points. Then, once you get stable, Start again, increasing the pressure. This time, go up to your therapeutic pressure. For your first treatment, that's going to be somewhere around 8 pounds per square inch of pressure. You're going to want to keep it at this level comfortably for, in the beginning, about 10 minutes. But eventually you're going to want to work this up to a 20-minute session with up to 12 pounds of pressure. More is not better. When you're done, pull the cord, release the pressure, and slowly take off the neck device. Once the Cervi-Trac is removed from your neck, apply a soft collar for an additional 20 to 30 minutes. You'll notice there's a notch on one end. That notch can be placed under the chin for comfortable stabilization of the neck, or it can be reversed, notch down, for a more aggressive approach. Use the soft collar for 20 minutes after every neck decompression session. The reason for this is that it takes about 20 minutes for the muscles of your neck to resume their normal length. And during that time, if you're aggressive with movement, you could cause spasm in the neck. Plus, it just feels good. Also, use this soft collar throughout the day while you're working on computers, on your phone, or just relaxing for added improvement. The Cervi-Trac also comes with a docking platform that you can use to administer cervical decompression while lying down. Simply put your collar on and then assume a supine position, allowing the Velcro on the back of the collar to snugly lock into place on the dock. The dock is at an optimal angle for the most benefit in cervical decompression. And it's comfortable. Look, if you're suffering from a bad neck and you don't want injections, you don't want surgery or taking medications, the Cervi-Trac could be the answer for you. It's helped thousands of my patients. It's helped me with my own neck pain. And DDS is a great company. They give you a 60-day risk-free trial. They'll ship one right to your house. You try it for 2 months. If it doesn't help, you get your money back. You can't go wrong. Plus, if you get a DDS, use promo code Dr. Stokes. DDS will give you an additional 10% off your purchase price, and you can email or text me any questions you have. I'm happy to help. Thank you for watching. Please subscribe to the channel and be sure to check out my other videos on supplementation that can help your neck heal and improve even more. Thank you.